Do you feel pain in your knees every time you walk, even if it's just around the house or a few steps in the supermarket? If so, you're not alone. More than 14 million Americans are now living with arthritis pain in knee when walking, and the number keeps rising after age 55. But here's the real concern. Many cases don't get worse because the disease progresses too quickly, but because of daily habits we don't even realize are harmful. In today's video, I, Dr. Eli Brighten, will share with you 5 common mistakes older adults often make that cause knee arthritis pain when walking to get worse over time. Some of these may surprise you, but if you stay until the end, you'll learn how to relieve knee arthritis pain when walking naturally and without relying on strong medications. Mistake number 1, poor walking posture, overstriding or leaning forward. Think back to the last time you walked outside or stepped off a curb. Have you ever felt off balance or instinctively used your hand to support your knee? If so, that's not a coincidence. Poor posture is one of the main reasons why arthritis pain in knee when walking becomes more severe, especially in those with knee joint pain elderly. When you overstride, bend your knees deeply, or lean your torso forward, you're putting excessive pressure directly on the knees, joints that are already worn down. This increases the risk of chronic knee arthritis, making every step feel like a burden. And fortunately, you don't need medications or special therapies to improve this. Just a few small adjustments to your stride can make a world of difference. Shorten your steps, keep your upper body upright, and land softly, as if you were walking on a gentle bed of grass. Sometimes, one small change can lead to a big improvement. Mistake number 2, wearing old shoes with worn soles and no arch support. I once met a patient, Mrs. Ruth, 78 years old. She kept wearing the same pair of walking shoes for over 4 years because they still felt comfortable. But she didn't realize one thing: the soles had worn down unevenly. Whether they wore inward or outward, this caused her feet to tilt unnaturally, leading to more pressure on the knees. When the soles are worn, the foot may roll too far inward, overpronation, or outward, supination. Either way, this throws off your body's alignment, and here's what happens next. At the knee joint, the misaligned leg forces abnormal pressure on the cartilage, worsening knee arthritis pain when walking. At the shin and ankle, your muscles and tendons are pulled unevenly, increasing the risk of inflammation and persistent pain. At the lower back, poor foot alignment disrupts your posture, often causing chronic back pain that many seniors can't trace back to their shoes. The fix is simple. Check your shoes regularly. If the soles are uneven, too soft, or lack arch support, it's time to replace them. Most seniors who walk daily should switch shoes every 6 to 12 months. Mistake number 3, ignoring early signs of knee pain. Mild pain after walking may not stop you right away, but it's often a silent signal your body is asking for help. Many older adults think it's just soreness, and they keep pushing through until arthritis pain in knee progresses to chronic inflammation. I've seen too many patients who came in when they couldn't even walk more than 10 steps, simply because they brushed off that initial pain. Don't let small signals turn into major problems. Your body is always sending you messages, and the key is whether you're listening in time. If you start feeling a dull ache after each walk, note it down. When it happens, how intense it is, whether there's swelling. If the pain lasts more than 10 days, or if you experience stiffness in the morning, don't delay. See your doctor promptly. Mistake number 4, skipping warm-up before walking and cool down after. Many people think walking is light exercise. I don't need to warm up, but that's a dangerous misconception. For those with knee arthritis pain when walking, the muscles around the knee are more prone to tightness, which leads to misaligned movements, inflammation, and gradually increasing pain over time. Sadly, many older adults only look for home remedies for knee arthritis pain when walking has already become difficult, instead of starting with a simple preparation step. You don't need to change everything. Just begin with one small habit, before and after your walk. Before walking, gently rotate your knees and ankles, stretch your calves. After walking, sit down and stretch each leg for 15 to 20 seconds. This is how you invest in the lifespan of your legs. Mistake number 5, eating foods that silently increase inflammation. You may be exercising correctly, but if your meals are full of red meat, sugar, and soda, you're feeding inflammation from the inside. Many studies have shown pro-inflammatory foods are hidden culprits that silently worsen arthritis pain in knee. On the other hand, foods like salmon, leafy greens, turmeric, omega-3 rich items, and vitamin D are considered powerful and safe home remedies for knee arthritis pain when walking. Eat smart. Each meal is an opportunity to heal from the inside out, not just for your knees, but for your overall health after 60. You've just uncovered 5 silent, yet harmful mistakes that make knee arthritis pain when walking a daily nightmare. But if you remember each cause and start taking action today, you can absolutely reduce the pain, improve mobility, and walk with more ease day by day. And this is just the beginning. In the next video, I, Dr. Eli, will guide you through the best exercises for people over 60 with knee arthritis, recommended by physical therapy experts, easy to do, equipment-free, and especially safe at home. Hit the subscribe button and turn on notifications so you don't miss any helpful videos in your knee care journey. And I, Dr. Eli, will continue walking with you step by step every day.